It can't be bargained with. It can't be reasoned with. It doesn't feel pity, remorse, or fear, and it absolutely will not stop ever until you are dead. But luckily, this time, the it is actually on our side. This lean, mean fighting machine is that antibiotic your doctor prescribed for your latest bacterial infection. So that little warning at the beginning, that was really for all you bacteria in the audience.
An antibiotic is a medication that helps fight bacteria, and we use them routinely for certain kinds of infections: ear infections, sinus infections, pneumonia, skin infections. What it does is it helps kill some of the good bacteria too, so there's always that balance. When we use antibiotics, we're using it judiciously to make sure that we try and attack the things that need to be attacked and get them better, get the patient better.
Antibiotics cure your infection by either attacking the bacteria directly or by interfering with the bacteria's ability to reproduce, effectively isolating the existing bacteria so your body can take care of the rest. Antibiotics are completely useless when you have a viral infection, like a cold or the flu, because, as we've said, antibiotics are made to kill. Viruses are not living organisms, so there's really no life for the antibiotics to attack. Now, if you take antibiotics for viral-caused illnesses or misuse antibiotics in other ways, it's like providing a training course for any, as of yet, non-harmful existing bacteria to become resistant.
Well, I mean, your body may become resistant to an antibiotic if you really need it, if you actually keep taking it when you don't need to take it. It's probably a bigger problem on a global scale. In other words, what you do to yourself doesn't have as much to do as that if we look at the entire local area, how many antibiotics are the local population taking, and so certain bacteria become resistant in a population. And that's really the danger, I would say, probably in overusing antibiotics, is that we get resistant organisms. Up until now, we've always found more potent antibiotics and more focused antibiotics to try and combat this problem, because bacteria are smart, they change over time. So they're of course going to mutate and try and prevent themselves being killed by the antibiotic. I think it's inevitable. It's just basically life and nature's cycle.
Since different bacteria cause different kinds of infections and have different mechanisms of survival, it's important for your physician only to decide which antibiotic is appropriate to infiltrate and destroy your current infection.
You should never share antibiotics with other people, because what your doctor may have prescribed for you is something specific for your type of infection. The kind of antibiotic one would use, let's say, for a urinary tract infection will be totally different than I might treat for sinusitis. Yes, some of them are the same antibiotics, but how long we treat, at what kind of dosing, can be different.
Unfortunately, like any good Terminator, there might be some innocent bystanders that get in the way. The most common of these are the good bacteria residing in your gut. Now, a simple, safe way to replenish these good bacteria is simply put them back in directly by eating them, usually in the form of probiotics. Probiotics are available in drink or capsule form and are also found naturally in live culture foods, like yogurt. I'm Dr. Keller-Wortham, and you're watching the eHealth Network. I'll be back.